Okay, welcome to the program, viewers. I'm Rohit Vyas. You're watching us, of course, coast to coast throughout North America. Have you ever had severe pain for a long time? Have you had any kind of other ailment, not felt well? Things like that, and traditional, conventional medication didn't seem to sort of work. I mean, any number of pills that you popped didn't get rid of that pain, didn't get rid of that particular fever, that particular blood pressure that you might be suffering, diabetes, whatever the ailment. Have you ever wondered if there were an alternative? The answer actually is yes, there probably is alternative medication available. Joining us in our studios is a gentleman whose name is Dr. Rajesh Patel. Dr. Patel is a Sujok practitioner. He's also a practitioner in acupressure, acupuncture, and many of the allied traditional types of treatments for all kinds of ailments. He makes his home in Toronto, Canada. He also practices here in the United States. He's also got his home in India. He practices there as well. He's from Gujarat originally. Dr. Patel, thank you for joining us on TV Asia. अब आप पहले हमारे दर्शकों को ये समझाइए कि सुजोग थेरेपी है क्या? What is it really?
अच्छा, सुजोग थेरेपी बेसिकली सुजोग मीन्स हैंड एंड फीट. वो इन्वेंट किया था डॉक्टर पार्क जे वू ने, जो कोरियन नागरिक थे और 30 इयर्स इंडिया में रहे और इंडिया में उनका डेथ हो गया 2 साल पहले. सो बेसिकली इट्स अ कॉम्बिनेशन ऑफ 3 थेरेपीज: Chinese therapy, Indian therapy, and Egyptian therapy, and which applies only shades, magnet, and color therapy. So this is basically Sujok therapy.
So now you said combination of 3. The Chinese, Indian, and Egyptian.
Right.
तो आप ये समझाइए हम लोग को कि ये were there different types of treatments from these 3 areas you're mentioning?
Yes, because they took उन्होंने मेरिडियन लाइंस चाइनीज से ली है और सीड्स इंडिया से लिया है और चेता तंत्र की टेक्निक इजिप्ट से ली है.
Okay.
So that's the combination he invented his own. So
इंडिया में कैसे वो रहे इतने साल?
वो 30 साल इंडिया में उन्होंने अपनी यूनिवर्सिटी थी इंडिया में और इंडिया और रशिया बेसिकली वो रहते थे ज़्यादा और उन्होंने काफ़ी स्टूडेंट वहाँ तैयार किए.
अच्छा, ये तो एग्जांपल दे दीजिए ना, ये सीड थेरेपी आप बता रहे हैं इज पार्ट ऑफ सुजोग.
राइट.
व्हाट डू द सीड्स डू? फर्स्ट ऑफ ऑल, व्हाट इज द सिग्निफिकेंस ऑफ द सीड? व्हाट काइंड ऑफ सीड आर वी टॉकिंग अबाउट?
अच्छा, हम डिफरेंट अलग अलग सीड्स यूज़ करते हैं. जैसे मेथी का दाना है, मूंग का दाना है, ब्लैक पेपर सीड्स है, कॉर्न सीड्स है, ग्रेप सीड्स है, देन सो मेनी वेरियस सीड्स वी आर यूजिंग. बेसिकली सीड्स क्या होता है कि भाई ऑल लाइफ इज पॉसिबल ऑन दिस यूनिवर्स ड्यू टू सन रेज एंड सीड्स. All otherwise any life is not possible without these 2. Okay, basically single seeds have so much energy, so it's create 100 feet tree, and all genetic in single seed belongs to seeds of the tree. अब आप देखें तो सिंगल सीड में जैसे और एटम बम की तरह एनर्जी होती है, एज मच एज एटम बम. ओके, लेट्स से आप जब सीड्स खाते हैं यानी एज ए फूड तो उसका डिफरेंट वो होता है, यानी यू गेट प्रोटीन, कार्ब, विटामिन्स, मिनरल्स. मगर जब वी अप्लाई ऑन द पर्टिकुलर पॉइंट्स, पर्टिकुलर कॉरेस्पॉन्डेंस पॉइंट, तो उसकी वो जस्ट क्रिएट बायो इलेक्ट्रिसिटी, क्योंकि अभी उसमें सिंगल सेल लाइफ अवेलेबल है सभी सीड्स में. हम ज़मीन में डालते हैं और जो ग्रो होता है बिकॉज उसमें लाइफ अभी है. तो दैट वे हमारे पैर और हाथ में एंडिंग नर्व्स है. तो एंडिंग नर्व्स 9 और 90 एंडिंग नर्व्स बोथ हाथ और पैर में है. तो वी हम उसका यूज़ ऐसे कॉरेस्पॉन्डेंस पॉइंट के हिसाब से करते हैं.
अब ये बताइए, हाथ में बताइए, लेट्स लुक एट आवर हैंड्स राइट नाउ.
राइट.
ओके, यू आर सेइंग एंडिंग नर्व्स आर
everywhere here,
all over the palms completely.
Yes, right.
Okay, is it on the back of the palm as well?
Absolutely.
So these are the ending nerves.
Ending nerves.
Okay.
Of all major organ.
Yeah.
And everything.
So abhi give me an example. What happens now? You're treating, let's say, okay, here I am, I complain about, let's say, blood pressure.
Right.
Okay. Now let's switch to these hands of mine. Now tell me what you're going to do with these hands of mine. Let's say I have blood pressure.
Right.
What would you be doing with those seeds? Those seeds.
Okay. Yes, seeds I apply on your thumb because that's represent head. Then I apply on your thyroid, your liver, and basically all correspondence points related to
so the hands would be up. You can use your own hands too if you like. So
right.
your hands would be basically like this.
Right. So, but I'm doing particularly on the feet.
Okay.
Because that's more practical.
Okay.
See, like with the hand, if I apply seeds on hands,
you can't use the hand.
Right. We cannot do anything during the day. But with the seeds, when I apply seeds on the feet, when we walk, it gives us more energy.
So उसके मतलब foot के नीचे आप डालते होंगे फिर.
Foot के नीचे और ऊपर दोनों.
So shoes के अंदर, within shoes and socks.
Yeah, you can wear
and you just continue your normal.
Absolutely.
Thing. And this can actually work. It can actually reduce.
Absolutely work like a magic.
How many people are practicing this right now?
There are, I think, thousands of people practicing, particularly Sujok. But my therapy is a little different than especially Sujok.
तो आप explain कीजिए, what is your therapy?
अच्छा, ये basically all therapies में head के points common हैं और different सभी organ के point अलग अलग हैं. तो let's say आपके मैं बैक ट्रीट करता हूँ. let's say आपको लोअर बैक का प्रॉब्लम है, sciatica का प्रॉब्लम है, तो मैं आपको 5 अलग अलग तरह की ट्रीटमेंट मिलेगी. आपको एक्यूप्रेशर की ट्रीटमेंट मिलेगी, एक्यूपंक्चर की मिलेगी, रिफ्लेक्सोलॉजी मिलेगी, शियास्तु और सुजोक. तो आपको 5 अलग अलग ट्रीटमेंट मिलेगी बैक के रिलेटेड. तो दैट विल वर्क फास्टर.
कितना समय लगता है इस ट्रीटमेंट के लिए?
ट्रीटमेंट में फर्स्ट ट्रीटमेंट में करीब 45 मिनट्स लगता है.
45, हाँ.
क्योंकि फिर डायग्नोस भी करना पड़ता है और दूसरा क्या प्रॉब्लम है.
And then continuation होता है.
Continuous every other day. Basically, I recommend 5 treatments, minimum 5 treatments every other day. Then after 5 treatments, you can have a break for 3-4 days and have another treatment. Okay. Like किसी को अगर कोई major problem है तो फिर उसमें treatment ज़्यादा चलती है.
Give me some specific examples of which ailments does this therapy work on. Where has it been very effective? Tell me.
Okay.
What are the most common ailments you face when people come to you? And then what do you have to treat them for most of the time, you think?
Absolutely lower back, upper back, mid back, sciatica, knees, arthritis. उसमें excellent results है. और diabetes में भी काफ़ी promising results है. अभी client of mine वो यही न्यू जर्सी में 2-3 महीने पहले मेरे पास आए, तो उस टाइम उनकी शुगर 400 थी. तो मैंने फर्स्ट ट्रीटमेंट की. उन्होंने लास्ट 25 साल से उनकी डायबिटीज़ है उनको, और ही इज़ लास्ट 2 ईयर से ही इज़ ऑन इंसुलिन डिपेंडेंट. तो फर्स्ट ट्रीटमेंट के बाद रात को 11 बजे फ़ोन आया उनका कि भाई साहब मेरा तो शुगर एकदम लो हो गया है, 50 बिलो हो गई है. तो मैंने कहा राइट वे, आप ऑरेंज उसके साथ हरी मिला के ले लो. वो मेरे 25 साल में फर्स्ट टाइम ऐसा हुआ है कि मेरी शुगर डाउन हो गई है. तो उसके बाद मैंने 5 ट्रीटमेंट दी उनको. तो 5 ट्रीटमेंट के बाद उनका, अच्छा पहले उनका A1C HbA1c उनका था 11.7. सो दैट मीन्स ऑलमोस्ट 375 to 400 उसकी एवरेज शुगर थी पहले. और बाद में जब मैंने से 5 ट्रीटमेंट ली, उनके बाद 2 महीने के बाद उन्होंने A1C करवाया टेस्ट, तो इट वॉज 175-200. That was average sugar. And he उन्होंने अपना इंसुलिन भी कम कर दिया 30%. So right now I'm also treating him, but I saw him after 3 months gap. So let's see real positive results.
But you've seen some good results already.
Absolutely.
Okay, so blood, that's one case of sugar we're talking about. Okay, diabetes and can it be reversed? Do you think diabetes?
Absolutely.
भी हो सकता है कि
Type 2 diabetes. That's what I'm trying to tell you. I have one client in Houston. This I'm talking about 6-7 years back. He was having type 2 diabetes and he was taking this regular medication. His sugar was that time around 200-225 average. So he contacted me. I gave him some treatments for almost 6 months. And during those 6 months, he was improving very gradually, or he lost almost 30 kilo. So all of a sudden, one day he said, my sugar is going down every day. Then we check him, and he was absolutely normal. So he just stopped his all kind of medication, no cholesterol medication, no BP medication, no diabetes. So this has been 4.5-5 years now. He is non-diabetic officially. Officially non-diabetic, and right now he is measuring still his blood sugar 4-5 times a day, because he eats everything. His blood sugar is 90 to 110. Absolutely perfect.
Okay, we'll take a quick break. When we come back,
sure.
I want to talk about something I want to show my viewers before we go to commercial break. I got this, it looks like a ring, and it's very interesting. It looks like a scrubber actually from your kitchen, but a miniature version, but it's actually a ring. And I'm going to ask him what this does for us, right? Our guest is Dr. Rajesh Patel. He's a practitioner of a traditional form of treatment of all kinds of ailments known as sujok. We'll be right back after this break. And welcome back, viewers. Our guest is Dr. Rajesh Patel. Now, Dr. Patel is a practitioner of sujok. We just found out it's a combination of treatments from 3 different regions, namely China, India, and Egypt. As I promised you, I'm holding in my hands these 2 little rings. They look like tiny scrubbers from a kitchen, believe it or not. However, they are rings, and I'm going to ask Dr. Patel what I'm supposed to do with them. Doc, tell me, what am I supposed to do with these now?
You roll on your thumbs.
Okay, I'm going to roll on my thumb. There we go.
10 times.
10 times.
Right.
So, both the thumbs?
Both thumbs, yes.
Okay, both thumbs. Now I'm going to do that 10 times. 1.
Right. Let me show you.
Right. Okay, why don't you do it on your thumb? Right. Raise it for the viewers. Let them see what you're doing. Here, you go ahead, show it to them.
Okay. You can start with your, I'm applying the right, but you can start with the left.
Okay, I'll do it on my left. You go and you raise it up so the viewers can see what you're doing. Yeah.
So this is like 10 times you are doing like this.
Okay.
Up and down.
All right.
And 10 times you can do it sideways. Okay. You can hold your finger sideways.
Okay, go like that.
Right.
And do it
so
like
20
this.
times with 1 finger.
Okay.
So you do it all 10 fingers.
Okay.
So it'll take, in the beginning it'll take 12 minutes, but afterwards you can have in 8 to 10 minutes.
Okay.
You can do up to 3 times a day, but no, you cannot do after eating heavy supper or lunch.
So it has to be before any meal gets into your...
Or 1 hour after...
thing. Okay.
Right.
Now, what is this doing? It's pretty tight, going around my thumb.
This basically stimulating all the 990 ending nerves in our body.
Just doing this on the thumb,
exactly,
all the fingers, etc.?
Yes. Even minor problems like knee pain, shoulder pain, elbow pain, it will go away miraculously.
What is in this ring that I'm, doing this with? What is this? What is this ring? What does it contain?
This contains just a metal, white metal.
Just a white
metal. But the thing is, the points is pinching on the nerves. This gives us a benefit.
Yeah, because it feels rough. It feels like a little rough, and it's sort of, it's poking. In fact, my thumb has gotten a bit red here. I can show the viewers right now. But it's interesting. So it actually stimulates. It's sort of,
stimulate all the nerves.
Yeah.
So it's basically everybody gets benefited.
Okay.
Even child can do it too.
Okay.
It is absolutely safe.
Okay.
Just like sujok therapy.
Right.
It is absolutely safe. There is no side effects of any kind.
Of any kind. So this is something, you're going to gift me this.
Yeah, yeah.
Thank you very much. I'm going to test this, okay?
Sure, absolutely.
Okay. Now, let's see. You've talk about some of the other ailments that you've been able to treat with this kind of practice.
Yes, I have so many cases of especially sciatica. That's a really big problem right now in North America. Due to stress, it's flare out more. It was stay docile if you are not in stress. But since sciatica begins with L4, L5, that's one of the biggest nerves in our body. Start with the small brain to all the way to the feet. And once we have inflammation or pinching, anywhere L4, L5, we get so many different kind of pain. And if we don't treat it sciatica, person gets paralysis. So it is serious.
How about issues such as heart disease, things like that?
Yes.
Can these 3 treatments help people?
Yeah, in the beginning, it could be preventive. But after, once you have a heart problem, then the treatment can be little helpful.
Okay. So it should be then, you can probably do it in conjunction with, conventional medicine.
Absolutely.
Right?
Yes.
Okay. Is this, now let's talk about acupressure.
Right.
Acupuncture, which is also your area. Do you practice that in conjunction with this? इसके साथ आप करते हैं या सुजोक के साथ?
मैं नहीं एक ही साथ करता हूँ. मैं अलग भी करता हूँ. मगर I recommend doing on feet all 5 therapies together. Because उसमें benefit इतने मिलते हैं. यानी single any therapy से ये 5 में ज़्यादा benefit मिलते हैं. और ये absolutely innocent है. There is no side effects. You don't need any kind of medication, no food restriction or anything. तो मैं आपको बोल रहा था सciatica का मेरे पास 9 केसेस है जो डॉक्टर ने बोला था कि सर्जरी करवानी पड़ेगी और विद इन 1 month to 6 months आई हैव क्योर ऑल ऑफ देम Absolutely, they are absolutely normal, without any medication.
So, do doctors like you, or do they?
No, I don't think so. They like me.
मैं पूछ रहा था, just, to be sure,
Even the pharmaceutical company, they won't like me.
They'll be out of business. Yeah. Everybody's going to be out of business. आप ये बताइए कि what qualifies you to be to call yourself a specialist of sujok? How do you qualify for something like? What kind of background do you have to have?
I did my masters in Colombo University, Sri Lanka, and I also did my doctorate at same university.
So what was your doctorate and what was your masters in what?
Masters in Sujok Acupressure.
In Sujok, okay.
Yes.
So
And
they have a university degree for this? For
yes.
Sujok?
Oh yes.
Okay.
It's based in Colombo.
Colombo, Sri Lanka. Yeah.
Right. And I did it for 5 years. And I'm practicing since last 15 years. So.
Okay. And how many patients do you have worldwide?
Like average per year, I'm doing almost 3,000 to 4,000 session altogether.
So finally, give me. Let's tell our viewers what should they do if they've gone to a regular doctor. And we're not selling anything or trying to promote anything here, by the way. But I just want to know out of curiosity, based on the kind of thing you are doing and others like you practice. अगर किसी को कुछ बीमारी है, बहुत serious acute बीमारी है, वो जा रहे हैं, conventional medication treatment के लिए, regular physicians के पास ऐसा कुछ काम नहीं होता है, तो फिर आप recommend क्या करते हैं? How do they use traditional?
मैं absolutely recommend करता हूँ alternate therapy, either sujok, acupressure, acupuncture, या किसी भी alternate therapy जिसमें दवाई की जरूरत ना हो, ऐसे में जाए, तो उसमें ज़्यादा बेनिफिट मिलता है और उसको there is no side effect उनमें.
That's the main. The key is side effect.
That's the main key. और ये जो practice हम जो कर रहे हैं उसमें we can cure anything, you name it. So like and there is no side effects. Like let's say one of my patient in India is having blood cancer. So last 1.5 years there is no medicine for him, no food. Like we only give him raw food, no masalas. Nothing like kind of no sugar, no oil, nothing, and he is improving dramatically. Year and a half ago, his white blood cells were like almost 120,000.
So reduced हो रहा है. So
reduced to
remission में जा रहा है.
Absolutely. अभी he is reducing to 35,000 without any medication. Just special diet, this therapy, laughing therapy, breathing therapy, and in India they call ozone therapy. He is applying every single thing under my care, and we are getting so excellent result out of this.
तो आपके experience में क्या ये लगता है कि अभी traditional medicines, traditional treatment को popularity हो रही है? Are they getting more popular? Is it becoming more? Are more and more people around the world becoming aware? Is what my question.
Yes, I think they are more aware. Plus, there is no side effects. That's the main thing. In आप देखें तो एलोपैथी में क्या है कि आप दवाई लो तो दे सप्रेस द डिजीज, दे आर नॉट क्योरिंग इट. ये थेरेपी ये प्रिवेंटिव है और ये क्योर भी, मोस्ट ऑफ चीज़ क्योर भी कर सकता है, तो उसमें ये फ़ायदा ये है. और बिना ही दवाई के अगर कोई क्योर कर सकता है तो उसके जैसा अच्छा क्या हो सकता है.
ओके, डॉक्टर राजेश पटेल, द प्रैक्टिशनर ऑफ सुजोक, बहुत बहुत धन्यवाद आप आए हैं
हमारे
स्टूडियो में. थैंक यू वेरी मच फॉर जॉइनिंग अस. आई अप्रिशिएट इट.
थैंक यू वेरी मच.
थैंक यू व्यूअर्स फॉर वाचिंग. आई एम रोहित व्यास.